coronavirus outbreak is killing people.
The novel virus was identified in Wuhan, China in December 2019. A lockdown in Wuhan and other cities in Hubei province failed to contain the outbreak. The World Health Organization declared the outbreak a public health emergency of international concern on 30th January 2020 and a pandemic on 11th March 2020. Since 2021, variants of the virus have resulted in further waves in several countries, with the Delta, Alpha and Beta variants being the most common. As of 28th July 2021, more than 195 million cases have been confirmed, with more than 4.17 million confirmed deaths attributed to COVID-19 pandemic, making it one of the deadliest pandemics in history.
The ability of this strain to impact or infect other people faster was much higher than the first wave.
On March, the first case of COVID-19 in Uganda was confirmed. The confirmed case was a 36-year-old male who had traveled to Dubai on 17th March 2020 for a business trip. On returning to Uganda, he was confirmed sick, and other 8 cases were confirmed by the Ministry of Health on 24th March.
That Uganda has confirmed her first case of coronavirus disease, COVID-19. The confirmed case is a 36-year-old Ugandan male who arrived from Dubai today morning, Saturday 21st March at 2 a.m. aboard Ethiopian Airlines.
In his address of the 18th March 2020, President Museveni put out 13 actions that dealt with the pandemic as well as other associated matters. Among the 13 measures were the closure of the educational institutions, which accounted for 15 million young Ugandans. He as well suspended communal prayers in mosques, churches, or in stadiums and other open-air venues, as well as imposing a curfew, among others.
Mu buyumba eyo munda eyo mu mizigo awo akabi wekali singa omuntu asigala singa avira motoka eri walako n'atambula.
Uganda is now dealing with 5 different coronavirus variants that have fueled aggressive transmission as the country suffers the second wave of the pandemic.
The situation is dire. We are officially having what we would refer to as a second COVID wave. So we are admitting lots of patients who are critically ill. First of all, there's the rate of number of cases that we are registering per day is going higher and higher. I think as per last week, I hope I have the stats right, but probably 1,000 patients tested positive.
Therefore, forced the Ugandan president, Yoweri Museveni, to announce a 14-day nationwide lockdown to prevent the further spread of the coronavirus under the latest measures. Among the measures was putting again a curfew, and all shopping malls, arcades, hardware shops, and all non-food stores except for supermarkets and pharmacies were also suspended for 14 days. Members of the public, except individuals transporting cargo, were instructed to stay home. But Ugandans couldn't sustain remaining indoors, decrying of hunger. They could therefore force themselves into the city center to work. As I was doing my journalistic duties around the city center, I landed on several roadblocks instituted by police to deny Ugandans access to the city center. I asked some of them as to why they are flocking the city center, and yet they were ordered to stay home due to the ongoing effects of the pandemic. This is what they told me.
Ekikulu ekisinze nze okundeeta mu kibuga muno kyakulya n'embeera gye ndimu si nnungi. Nina abaana abo 5 tebalina yadde taata. Nze taata, nze maama nga wondaba. Abaana abo 5. Kati abaana 5 ngenda tuula mu nnyumba, ekirwadde kyo wekirina ng'enkimanyi.
Obuzibu bwe tuleeta mu kibuga, ekibuga ekyo bakizimbira abantu. Ate ekiriwo kyonna ffe tulina okuleetamu ebintu ebiyimira kibuga. Nenze ndaba bwe tugenda ebyokulya tubijja mu kibuga, buli kimu kiri mu kibuga, kati ate batugana kugenda mu kibuga. Ffe situmanyi lwaki.
Bintu tebikyatambula byonna byafa, ate ne ssente zaagana okutuuka. Kati ebyannabbanja byafuuka bya bbanja. Lwekiraba ekintu ekyo buli omu kimuluma. Ne bakusindikira message ne ssente nga tuziriiko. Ogenda okugendayo oliko okuzira bagamba
Security personnel were staged around the city center to implement the presidential directives.
Sijja kupowa. Inzirusa okuva ku makya paka sawa eno sinabafuna yadde n'ekikumi nze naye era nkyadduka era n'enkyankeera. Sigenda kubonaabona.
Ugandan Rain's statement of a coronavirus lockdown throughout is squeezing the ability of many Ugandans to earn a living. Street market traders are forced to bike, walk long distances, or just sleep in the marketplaces. Ugandans living in the countryside are forced to walk for long hours to get to town. The aim is to save lives. Making a living is once again a struggle for traders amidst the COVID-19 pandemic. With Uganda's first lockdown in March 2020, the government gave flour, beans to the urban poor, which many hope will be repeated. However, Ugandan Prime Minister Robin Nabanja said are going to identify the vulnerables and send them money via their mobile accounts. Bedson Mumbere, Smart 24 TV.